Has seen the document?
Yeah.
So regarding the relation Sepia, Murex, Spongia, and Iodum, we start with the connection between these drugs, and then we see they don't belong to a particular group. Like all the drugs that we have done up to now, either they were belonging to some common family, or they had a relationship between them, or even some kind of a drug relation or therapeutic relationship between them, one following or complementary, acute, chronic, that relation was seen. And then we were doing the carb remedies, but the carbon group was there. And then we did drugs with the lac group belonging to one the sarcodes, and then we did the spider group. But if now we are going to these four drugs, you see that to find a connection between them at one first sight itself is a bit difficult because they don't belong to a same kingdom. The first three, all are sea creatures. Sepia is the cuttlefish. Murex is actually purple fish, a kind of what is that? Uh, cuttlefish, a sea creature, and even the spongia, which is taken from the sponge, the water sponge. So all the three are the sea creatures, which means it belongs to the animal kingdom. And then we have the item, and that is actually belonging to the chemical kingdom. So we don't see a similarity in origin between them, at the third and the fourth. But there is something that is in relation, and when we go through that, we see that, as I told, the three in Animalia group, and the item is actually the chemical, or it belongs to the halogen group. If you remember the periodic table, it is in the halogen group, item is belonging to. So, and now we again go within that sea creatures, Sepia, Murex, and Spongia. Sepia and Murex, they are belonging to a still higher phylums. I didn't go in detail with the phylum classification because it's so complicated and we don't have to learn much about that phylum classification. But if you remember the classes in biology you might have taken for your SGPM, there were a lot of classes going from the primitive ones to the more advanced one. So when we take these three sea creatures, Spongia, it belongs to more primitive one, that is the phylum Porifera, more primitive type of organism. And then a little bit advanced will be the mollusks group, and it is in that mollusks group the Sepia and Murex is belonging to. So even in the sea creatures, all the three are coming, there is a gradation in between. One is more primitive, and the other two are belonging to the advanced group. So now when so that is the general thing, and now we again go into we see that sponge here is actually the water sponge. Sorry, I didn't keep a picture actually. I'm sorry. So yeah, sponge here. Anyway, it is a sponge, but it is actually a seawater or marine sponge. Uh, and at the same time, we have a medicine which is called as Badiaga, and that is actually a freshwater sponge. So even in homeopathy sponge, we have the fresh water and the seawater. So the seawater sponge is what the sponge is, and then we have the freshwater sponge, Badiaga. But Badiaga is actually a remedy which we usually learn only for MD purpose, and it is more related to glandular complaints and very rarely prescribed also. So, because of that thing, though it is a freshwater sponge and in the MD level, sponge and Badiaga is asked for a comparison, it's not that much important in case PHMS in that level, and also practically also therapeutically also we don't much prescribe Badiaga. So that doesn't come, but it will be good if you remember that we have two sponges. One is seawater, which we commonly use, and the another one is which is the freshwater, and that one has not been given in this relationship. Now, the item it actually came in that relationship because this spongia, the seawater, it consists a lot of minerals in it. One of the most important mineral inside this sponge is actually iodine or iodide. And because of that, so when we say spongia, it is a seawater creature, it is a sponge, yes, but the chemical constant, there are many chemical constants, but the most important one is actually iodide. And hence, spongia show some similarity with iodine because of the same component. So, though the sources are different, one is actually in the chemical kingdom and another one is in the sea creature, they have the same component or iodine or iodide. In sponge, it is actually the iodide form, and iodine is actually the pure element. Anyway, they have that iodine content in that, so that they have similarity in action. So that is how iodine came into the role. And iodine is also, in a way, we can say that when we take the seawater, the constants of chemicals in seawater, natrum and all the other things will be the, what is that, chloride, all the chemicals, and one of the chemical in seawater will be iodine also. So that is how the all the things most among this the sepia or the murex and the spongia, the most important one which is having a large quantity of iodine is spongia, and there is a strong relationship of spongia and iodine in terms of similarity in action because of the same composition. And because the other two also belong to the seawater, and in the seawater generally the iodine component is very high, we can see there is similarity of these drugs. So everything comes with the fact that the iodine is present in all. So even though the sources are different, because of the common thing iodine, they have come together. You got the point how they came.
Yeah.
Okay. So we have said about the spongia that it belongs to the most primitive group, the poriferae, and it's a seawater or a marine sponge. And then we have the badiac. Then we're going towards the mollusk group. So mollusk is the group in which Sepia and Murex is coming. So it is the largest of marine phylum, and around 85,000 species are recognized. And these vary in size, anatomy, behavior, also habitat. In the mollusk, there are two important categories. One is cephalopods and another one is gastropods. So gastropods are more less advanced, I can say. Within the mollusk, if we are going to classify, the less
Mhm.
advanced will be the gastropods, and then but the majority of mollusk belong to the gastropod category. 80 percentage of mollusk, the 85,000 we told, majority 80,000, 80 percentage belong to the gastropods, a little more less advanced. Whereas in the group of cephalopods, it is in this group. 1 minute, let I give it a color. So it is in the group of cephalopods, the
Mhm.
cuttlefish, that is our sepia, is belonging to. So when we categorize that, we learned earlier that Murex and Sepia, it belongs to the group of mollusk. And now again we classify mollusk into two, gastropoda and cephalopoda. It is in the gastropoda, the less advanced variety, Murex purpura is coming. So that is the complete name or the full name of the drug, Murex purpura. And
Mhm.
cephalopoda, the medicine Sepia comes underneath that category. And do you know what is the full name of Sepia?
Um, it was officinalis.
Mhm. Officinalis. Is this the spelling
Ah,
correct?
yeah, I think so.
Now we go to the halogen group in which iodine is belonging to. So exactly if we say, I told you 7A, no, the seventh group, but it's actually 7A. There are in the periodic table there is 7A and 7B. I forgot that. Anyway, this belongs to 7A, and we have other remedies belonging to that group. Five actually, and that is chlorine, bromine, fluorine, iodine, and astatine. We don't have much, what is that, verified proving with astatine, but other, the chlorine. Chlorine, as such, chlorine, we have chloralum something, but it's usually in a combination form that we use chlorine in homeopathy, like natrum chloride, barium chloride, uh, like that. The chloride form only we usually use chlorine, not as the elemental one. But we do have
Mm.
medicine that is bromine, fluorine. Uh, we use hydrogen fluoride HF form, and then fluoric acid form, not the elemental one. But iodine also, the iodine we use the elemental form. So now when we go for the halogens, the word halogen it actually originated from the Greek words, two words. The word holos, which means sea salt. So it also indicates iodine is actually a component or a salt which is present in the seawater. And that's how everything, the four came together in a relationship. And genes, which means born. So halogens means these are the chemicals which are born from the seawater, or which is seen in the seawater. Then halogens in the when we see chemically, they have seven electrons in their outer orbit. Just I mentioned because we have some connection, we can connect it, or we can apply doctrine of signature with that point. So that is why I just included. Otherwise, chemically, it is not a relevant point for homeopathy. So halogens, they are actually having only seven electrons in their outer orbit, and the outer orbit uh, they actually should come into 8 to have that stability. If I don't know, like there were two so many orbits, PQR or something, and the second orbit it should be 2 8 something. I forgot that formula and all. So if it is coming the last orbit, 8 electrons, then only that elements will be in a stable situation. But halogens, they have got only 7 electrons in their outer orbit, so they need one more. And they need that one more so that they can become a very stable compound. So they chemically are in a constant trial to get that one electron by any possible chemical reaction. So when we apply this principle to the therapeutic level of homeopathy, we see halogen remedies are very active, restless, anxious, and excited because they are highly active and highly restless because somehow they want to increase the electron level from 7 to 8, get some electron from some reaction somehow, and then become stable. So that being very active and restless and anxious nature we can see in halogens. Um, so now the five remedies we told, and we are discussing only about iodine. And iodine, it is the major component which is required in the production of thyroid hormones. So there itself we get the point that okay, iodine is a medicine which is going to produce some effect with thyroid or some or the other thyroid complaints. Iodine is a very good remedy. So now we go to the individual medicine, and I'm dealing with only Sepia individually. All the other drugs, because they are comparatively smaller, I will be doing when we are doing the comparisons. So
Okay.
regarding the Sepia officinalis, this is our cuttlefish, and
So
there
pretty.
are people. Huh?
It's very pretty.
Yeah, it is. It is actually very colorful. There was a black and white also. I mean, some grayish, not black and white, the grayish one actually. But this one I felt so pretty, so beautiful. I just put. And yeah, there are people who eat this. Even I had eaten. I love that actually. But they have the ink which they can eject whenever they're some exposed to some danger. So if we are consuming it for eating purpose, we should be very careful to remove that ink sac from that. If the ink is getting spread in its meat portion, then it will become poisonous. It is actually the ink, the dried ink which we use for the medicine. We don't use the whole animal. They have
Okay.
that ink thing in that
Yeah,
inside
yeah.
their body. Yeah, so it is the ink that is taken out and dried it, and that is triturated, and sepia is made. We don't
Oh,
touch the for medicine. We don't touch the organism. We just take that dried ink. But for eating purpose, yeah, then at that time you should be very careful that that ink is not spreading to the meat portion because it is poisonous.
Okay.
Yeah, it can't kill anyone, but it will make, if you have seen, they will eject this ink and make the water very cloudy. So,
Yeah,
and
yeah.
in that time, yeah, and in that time they escape, and that's how Sepia generally is. When they are irritated, they are people who don't want to get contradicted. So when we are trying to contradict them or something, or they got highly irritated, they say something and then vanish. Vanish in the sense they, we are sitting in a group, maybe among your friends you might have sometime experience, and
Mm-hmm.
you're saying something and this person got offended, and she will say something and then she just escape from that area, and you will be sitting wondering, staring at each other's face, what happened just now, or why the person said so, and what is the relevance. So they are
Mm-hmm.
like, they show their defensiveness or their irritable nature in 1 second, make you clouded, like the ink when it is spreading, the enemy actually get clouded. It can't get the clear vision. The water is clouded. So once the water get cleared, sepia has gone from the, or the cuttlefish has gone from the. So the same is the personality when they are put in such a pressure situation, or when they are contradicted. They say something, blurt out, and then they just vanish from the situation. That the other people sit for a while and have to think why this person responded so. So that's a kind of nature that we can extrapolate therapeutically also. So in case of
Oh.
sepia, the common name is cuttlefish. Got it?
Oh, yeah, yeah. I got it. I got it.
Okay. So common name is cuttlefish and belonging to cephalopoda. It is the trituration of the dried liquid contained in the ink bag, or the dried ink is what we use, not the organism. And the provers, there were four provers at different types: Gullen, Von, Gers, Dove, Gross, Hartlob, and Wale. Five other, okay? It doesn't anyway matter. Clinically, of course, sepia is one of our important polycust remedy. So the constitution, the mind, the head to foot, we have everything very much important in case of sepia. So characteristically, sepia is predominantly a woman remedy. Nevertheless, it can be given for males also. But when we prescribe sepia for males, usually they should be having some substance abuse, some alcoholic nature, and other general features should also match. But until now, even from my, if I say from my clinical exposure since second year BHMS, like
Uh-huh.
seeing from my teachers, I have never seen anyone prescribing sepia for a male. I myself have never given. But they say that,
Okay.
so it is more predominantly, even pulsatilla, we though we say it is a predominantly a for female remedy, pulsatilla is being prescribed for males also, because they have that characteristic respiratory complaints of pulsatilla, the GIT complaints from fat foot, and then in the respiratory complaints they have the nasal discharge, yellow greenish, or the blunt in nature. So this is something we can find very commonly in a male also, or even stomach dyspepsia or diarrhea from eating a fatty food, cake. A male can also can present one day in the clinic with this feature, though there is no underlying deep pathology or miasma over there. So pulsatile is something we can give for males, and I have seen that. But sepia, it's very rarely. I mean, I have not seen yet a male being given sepia. Uh, so sepia is predominantly a woman remedy. It affects the reproductive organs of both sexes, and a large number of the symptoms occurring in other organs have some relation thereto. So the main area, or the main organ in which the sepia is acting is actually the reproductive organs, and all the other complaints, because sepia may have some gastric complaints, not may have, they are having gastric complaints.
Okay.
They do have very characteristic skin complaints. It's a very good remedy for ringworm and all, and respiratory complaints. So though they have symptoms in other systems, Uh, Most of it they will be somehow related to the reproductive organs, some fault with the reproductive organs, and that exhibited affecting the other organs. That will be the usual feature of sepia. Then sepia is a medicine which is especially for women, and that too during pregnancy, childbed, and lactation. So the important changes, not important, because it is the reproductive organs. So during pregnancy and childbed or lactation period, and childbed is actually similar, the lying in period. So this medicine, Sepia, is more given during that time, but not exclusively. Yeah, maybe because they do have action in our breast, so lactation and pregnancy, morning sickness, constipation is highly characteristic in Sepia. So that might be the reason they told, and it is like a change of life phase, we can say. And in some women, there can be the postpartum depression, which is highly characteristic in the lying in period. So, a kind of depression we can see in sepia also. So, that might be the reason why it is more indicated in this particular phase of women's life. Nevertheless, it is also indicated during the climactic period, like lacasis. Sepia is also very important remedy during the climactic phase. Then sepia is also called as the washerwoman's remedy because many of their complaints are aggravated from washing clothes or doing the laundry work, especially maybe the back pain. Now, when one of the general feature of sepia is all the pain will be radiating towards back. So whatever when
And
now
digestive complaints.
yeah, everything they feel like that the pain is coming towards back.
Mm.
Mostly. Even the digestive complaint, or maybe because we told that when the digestive complaint is there, this person will be stress. So it may be the manifestation of the uterine complaint, or there is underlying uterine complaint which is affecting the gastric area. And not only that, gastric complaints. The important gastric complaint they have is the portal congestion, or the portal stasis, which means there can be a hepatomegaly or a splenomegaly. We'll see later in the slide. So it can be a reflection of the uterine complaints they're having. Anything, the pain, they ultimately feel that pain from different parts of the body is coming and concentrating in the lower back. So these women, the sepia women, usually they will be coming to us 80% of the times saying that they have very severe backache. And backache is such a thing that most of the backache is psychological in nature. It's actually we call it as a psychosomatic one. It's in a real one like IVDP, that will be somewhat very rare to find that resulting in backache. But generally, if we take backache, we see in the medicine textbook also, it is very difficult to discern. I mean, if they have a real pathology in the X-ray like IVDP, disc prolapse, IVDP is a disc prolapse,
Mhm.
and then what is the other condition? There is a condition in which in the bamboo spine. What's the technical
Okay.
name for bamboo spine? You remember?
Bamboo spine.
Yeah, the it's also called all the vertebral ankylosing.
Spondylitis.
Yeah, ankylosing spondylitis.
Um.
So these are typical organic lesions of the vertebral column, and that resulting in backache we can very clearly discern. But most of the people in their 30, 40 years, they come with non-specific reasons. So when we go for the medicine textbooks, even the medicine books, also we can see that most of the backache, the reason will be something psychological. So when we prescribe sepia, the uterine complaints, it will may be coming towards it, or it may manifest as a back pain, and they have prolapse also. So everything in sepia, the feature will be the pain radiating towards back. And even during pregnancy, backache is characteristic. After delivery, backache is characteristic. Because maybe if it is cesarean that was done, they may be using that what is that anesthesia. So because of that, the backache is characteristic. So many things might be coming together with sepia and these three stages. That might be the reason they say that sepia is especially suited, but also very good for the climatic period because they have another important complaint, that is uterine prolapse. And uterine prolapse also, either it can happen due to multiple pregnancy or due to some complication during the process of delivery, and otherwise usually seen around the age of 60 plus at that time. And these ladies will be having complaints or diseases attended with sudden prostration. Prostration is extreme weakness, extreme, not just weakness or just tiredness, extreme. The sudden prostration and a sinking faintness, that they will be readily getting vertigo. That will be their manifestation.
Mm.
So the washerwoman remedy, because the complaints are brought on, either brought on or aggravated after the laundry work. So the ailments for them, even laundry work is given much importance, and also mentally the long continued grief. The constitution, I don't know the last. I have taught you Sepia in the last semester also. At that time,
Yeah.
yeah, I told you that they have a hourglass shape of their body. If they are
Mm-hmm.
very young, usually they will be having the model body.
Mm.
And I think it is either Vitolkas or Bailey. Bailey is a person who have written psychological
Oh,
homeopathy something.
daily something. Yeah. Okay.
Psychology of homeopathy or homeopathy homeopathic
Yeah.
psychology something. Yeah, but it is very nice to read that book. Yeah, so in that she has given the body shape of sepia to be hourglass, but not
Mm-hmm.
exactly hourglass in the sense that the hip region is going to be so wide, and not exactly. But they say it will be more like a frame like that of a male, not a feminine structure. Uh, hourglass is, I mean, both we can see. Hourglass, the model like structure, but then there are
Mm-hmm.
models which are not having much feminine, what is that, feminine type of body. They have, the model's body, not the actress, the
Yeah.
model's body. Yeah, they
Like
have a
very
single frame. Yeah,
mm-hmm.
a direct
Tall.
frame we can roll.
Uh-huh.
Tall also, yes, and they
Yeah.
will be very thin, very skinny,
Yeah.
and we don't find that a feminine character in them usually. It will be like if we are just drawing two lines,
They're
two
quite
straight
flat,
lines.
you mean? Is that what you're saying?
Yeah, they're quite flat in every
Okay.
sense.
Okay, yeah, yeah.
The female feminine structure they don't have. So in the younger age, Sophia women will be like that, like the models. But then maybe 30 plus, when they are going for a pregnancy or something, they may have that hourglass shape of the body. But like a male body, there won't be any extra deposition of fat in the hip region. Even that hip region, it will be in the same width of that of their shoulders. Otherwise, in other females or the actress, the film movie actress, if we say, or general females usually who are not that into model, their hip region will be wider to their shoulder region.
Okay.
But in case of models, this hip region will be either same to that of this shoulder region, or it will be uh, mm, smaller to that. And that's a feature of actually male bodies. Even their male body, their shoulder region will be very broad. And when we go to the hip region, not the 30, 40 plus who have heavy bellies, okay, not that. but the other way, the hip or the waist region will be uh, lesser in size or width when compared to the shoulder part.
Okay.
So, like that, a masculine body, this Sepia lady will be having in her younger age. A masculine body in the sense that flat and this type of body. Let us see if there is a pen. Okay, I can say you.
Mhm.
If you imagine a female body, we can draw like a triangle. Um,
Okay.
and a male body, it will be an inverted triangle.
Okay.
You got it? Or should I draw in the board? There is a board
No,
over
no,
here.
it's okay. It's okay. Yeah, I can
Okay. So
imagine that.
anyway, yeah, that is the feature in their constitution. So these people are actually dark hair, rigid fiber. Rigid fiber means very, as a like a model or that thick type of rigid in the nature, very not so laxy one.
Oh,
Yeah,
okay.
not so laxy one, but when we go towards the 30, 40 plus, yes, they become lax with lax muscles and all. Otherwise, they're very model-like body, the rigid fiber. And we can compare this feature to their physical face also. In the physical face also, in the appearance and also in their mental nature, they're quite inflexible type of people. But still, they have a mild and easy disposition, and they have the scrofulous contents, where the glands, especially the lymph nodes and other glands in the uh, uh, neck region, is affected. So, this the scrofulous, that this is they having dark hair and rigid fiber. But that is the younger women. But once they cross 30, 40, the mothers will be pot bellied, or they will be having a swollen, not swollen abdomen, like a hanging type of abdomen or a pot belliness nature. And then they will be having a yellow saddle across the nose. Um, the leukophlegmatic constitutions that is very tired and they don't want to do anything. Those are the nature. And this yellow saddle across the nose is a characteristic feature for the Sepia remedy. And they also faint from least exertion, that we have seen that they have that sinking faintness. So least exertion, they may faint, and that is why they don't want to do anything. They just want to, they're very tired, very languid in nature. They don't want to do anything.
Okay.
So this yellow saddle, which is seen in the upper part of the cheeks and nose, it is actually a telltale phase of uterine ailments. And
Oh,
my teachers used to say that if a woman is having some kind of uterine troubles, it is going to affect her for a lifetime. May not be the present generation. That women are not just confined their life to the uterus, but in the previous generation, always if the women generally have some uterine complaints, because uterus is the organ for reproduction, so any problem, and if she is not able to conceive, or infertility is the, so the woman will be always getting worried, that woman. So that sadness will be seen on her face, and that is how they connect the telltale phase of uterine ailments. Because if there is a uterine ailment, it is not that extra deposition of melanin is coming over there. Usually, if there is some uterine ailments, mostly it will should be affecting her fertility. A childless or a issueless situation may be there in those women, and that constant worry will be manifested on their face as some this discoloration, or they are not taking care of their appearance or something because of that extreme grief, continued grief and all. So this yellow saddle, it is actually a telltale phase, or it is showing that this woman has got some uterine complaints. But how much we can connect this symptom to a present day woman who doesn't consider or limit herself to a reproductive organ, I don't know. But that is what we see in literature, and literature, the connection is like this. We have to connect it with the uterine ailments, the sadness, and then the disinterest, and together that sad look in them, it brings about so many discolorations. So discolorations on their on their face, and which shows that she's deeply affected or she's having some uterine complaint. Then, as I told, when men Sepia is indicated, they should be addicted to substance abuse, mainly drinking and also sexual excess. Though we say sexual excess, we later will see that maybe it was a sexual excess in the younger age, but once it is the stage of sepia to be indicated, they will be having aversion to sex. They don't have any interest in sexual intercourse.
Okay.
And as I told you, this sepia towards the middle age. In the younger age, it is more like a flat constitution, the rigid one, this body, the model type of body. But when it is in the 30, 40, they will be puffed or flabby person, so lacks muscles, and they are less frequently emaciated at that time because they simply don't care. They're gone into a stage of indifference, a long continued grief, so they don't care about their appearance also. So they will be more with a flabby body or a obese body, lacks muscle center, and they are very much inclined to sweat, especially in the genitals, axilla, and back. It's not that important, the sweating nature and where it is not that important, but the initial part, the constitution, what they won't be much emaciated, but lax muscle nature is what we see. So the general attitude is never one of strength and healthful ease, but of languor, lax connective tissue, and easily
Mhm.
producing paresis. But this is not a younger woman, the woman who had developed all the uterine complaints, the mental sadness, the physical affections, and after that, the don't care nature, that women will be having such a constitution. So languor is actually lack of energy or vitality, where there is extreme sluggishness, lack of spirit or interest, a complete stagnated one. That is the meaning of languor. So the when sepia is usually indicated, the woman will be in such a state. And if we take a case history, we could see that maybe this woman was a model or something, or
Mhm.
a actress or something during her younger years. But now, when she came to you and when she is in a stage of a need of sepia, her appearance had completely changed. Then regarding their mind, as you already know, indifference is one of their characteristic feature to anything and everything, even to family, husband, children, and any activity, job, whatever. So the thing that they were interested initially very much, now they are completely aloof to that things. They are not at all interested in those things nowadays. Then there can be anxiety. This also I have explained to you. They're very much anxious and real or imaginary evils, especially towards evening. Like the woman, even though they have this indifference, a husband or child is coming 5 minutes late, they start thinking the worst. Have they met with accident? Have they been hospitalized? Have they died? That kind of anxiety we can see in case of sepia patients. Then they have sadness, weeping, their dread of being alone, of men, of meeting friends, and all of this we can connect it to their uterine complaints. Though we say dread of being alone, they don't want to be in company also. It's just you be there, that's it. And maybe because of their fear and also this anxious nature, they may have a dread of being alone, but they don't desire for company also. That's another thing. And they do have a dread to opposite sex of men and also meeting friends. And men, we can connect that they have that don't have that sexual desire, so they are not interested to meet men also, or even casually with friends. So maybe because they feel like they didn't become successful in their life in their 30 or 40s, or their life changed completely in a 360 degree, and her friends may ask, oh, you are not this person years ago, now what happened to you? So because of those things, they don't want to meet their friends also. So when we see that they have dread of being alone, it is not that they desire company, they don't want their company, they don't want to meet friends, but maybe that when they are alone, they get scared, they get anxious, and because of that they don't want to be alone. Then they are greedy and miserly, like that of Lycopodium, but we can't say to the same extent as that of Lycopodium. And very indolent in nature, very lazy. Then the Sepia patient weeps when asked about her symptoms. She is very sensitive, however, should not be found fault with. So we shouldn't be finding fault with her. She says something, we shouldn't contradict her. We shouldn't be so critical towards her. We shouldn't be censorious. We should be like, okay, okay, and don't try to contradict her. She won't be
Miss,
liking.
the indolent part, is it because of the prostration that she is experiencing?
Yes, yes.
Okay,
Because we already told that she's having sinking fairness. The least thing that she is going to do, she might have this dizziness, vertigo. But
okay,
towards when we come towards the respiratory complaint, we'll see a very strange, very opposite type of symptom over there. Though we say even the least exertion is going to cause her vertigo. Now, when we go later, you will see exactly opposite one symptom. But that is that indolence. And then another reason, this is they don't want to do about that physically the prostration, but this indifference or they don't have the desire to do anything mentally also. They're completely indifferent. Like just imagine a woman in the 40, 50, not of your age, don't think from your age, but imagine the culture of this country around 40, 50 years before, like in your mother or your grandmother's time. Uh, and then imagine a 40-year woman who didn't have any children, and what the woman's nature would be. You can guess, and that would be a sepia. Because at that time, women were considered, even now also, even now, but now the concept is changing. That's why I told you to think from the remote, actually, the past era. Now, most of the women, or at least few of the women, they don't think that even if they don't bear children, their life had ended or the purpose of their life was not fulfilled. Okay, there are women who think like that, definitely, but there are women who independently, out of their choice, they don't want to have kids also. But
okay,
in the earlier years, it was like female are supposed to bear children, and if they don't do that, their life has been doomed. They didn't do anything particular in their life. So that women of 40 years who couldn't bear a child, maybe her husband even divorced her. I don't know whether divorce was happening at that time or got separated, or she was there in that house, but husband went and married another woman. So she become like an extra thing in that house. So, such a woman, they will be like, why even death is not coming to me at the age of 40? They feel like that life has ended. So, that much depression had come into their mind, their physical, that totally don't want to do anything. So, issueless women would be the, or in that is one condition where the uterine complaints is there. And another condition would be where there is prolapse. That's another important condition of sepia. Though we say prolapse, I don't know, sepia may not be indicated in a condition of prosidentia, which means the complete four stages of prolapse has happened. The complete uterus. I have seen only one woman where the complete uterus has got what is that? Protruded out, prolapse. It was completely outside the vagina. It wouldn't be placed backward. Sometimes there are different stages actually for this prolapse, even the anal prolapse or the rectal prolapse, and also the uterine prolapse. There are different stages, four stages, I think, and the fourth stage is the complete prolapse. When the organ has completely come out, we can see it from the, if it is the rectal prolapse, we can see it in the anal orifice region, and if it is the uterine prolapse, we see it in the vaginal region, the organ being completely coming out. So in the initial stages, we can just keep it. In the first stage, actually, it comes out when we are straining. If it is rectum, when we are straining for the stool, it comes out, and then it goes back by its own. And in the second stage, No, in the initial stage, I think they feel kind of something stuck over there, or a ball-like sensation or a balloon-like sensation they feel. In the second stage, is I think it comes out, but then it goes back. In the third stage, it comes out, but then it won't go by its own. We have to digitally push it back, be it this uterus or the rectum. But in the fourth stage, it has completely come outside. We can't put it back. Completely means not the whole thing. It is actually the three-fourth of that organ. There is a scientific explanation. I mean, medical explanation, medical definition. What is the fourth level? So around three-fourth of that anatomical structure will be protruded out. So it now if we are going to do keep it put it back, it won't go. It is completely protruded out, and the only way is the surgical treatment. So I don't think Sepia would be acting at that stage, the complete protruded stage, because even Hahnemann had told that we have limitation in surgical diseases. When surgery has to be done, means it has to be done. Our medicine is not going to act. But in the initial stages, when the patient was feeling in the first and the second stages, maybe at that time the Sepia would be working. So imagine a woman who is having this prolapse condition, the uterine prolapse. This is very much going to affect her sexual life. Even if she has the baby or whatever, this is going to affect her sexual life. So then also her husband will be like, okay, because at that time it was more important, even now also, but still, now at that time it was too much. But now it is reducing. The society is changing. So and the husband would be like, he's no more interested to have sexual intercourse with this woman because her uterus is lax or it is not tight enough, and he's not satisfied. So that woman also think like her life had got doomed. So age of 40 connected to the reproductive organs, it will be manifested in their psychologically and also physiologically, and that's a sepia woman. So this indolence, the languor, it can be physical in nature because of their physical tiredness, vitality being lost, but this can be also due to the mental feature that they don't want to leave again because they don't see any purpose of their life. Their main purpose was to do the feminine activities, but because of this uterine complaints, they are not able to do that properly. So such a lady. So they faint easily. We are again repeating. It's a keynote of the sepia weakness. So that's why they don't do anything. And this fainting easily we can see even when they do the lightest activity, like after getting wet. You can't imagine someone getting wet and then fainting, but they will because they have this we can connect with the extreme chilly nature. They're very extremely chilly. They want their body to be covered always. So maybe the wet, which makes them chilly, and then they get faint easily from extreme of heat and cold. But see the other things, riding in a carriage, even when they are not moving per se by their own, but that movement in the carriage, it is producing some movement in their body. The what is that? When they at that time when these medicines were being proved, the transportation might be used by hose carriage. So when the hose is carrying us, even the person, that kind of vibration the body is also going through. So even that riding in a carriage is a problem, and leave that, even kneeling at church. Kneeling in church can also bring about ending nature in that person. So in the female reproductive system, we saw that it is the uterus that is affected. And so in the younger year, when the menses is affected, it is generally scanty, too late, and irregular. Any complaint with menses is possible. It can be menorrhagia, metorrhagia also. Though we say it is scanty menses, it can be menorrhagia, metorrhagia, or any complaint with menses, but we should have all the other symptoms we are mentioning about. But generally, menses in case of sepia, it will be irregular, very painful, and also too late and scanty, almost similar to our pulsatilla. Then there might be violent stitching pain, and this stitching pain that is characteristic, not the nature of the pain, but the direction. The pain, the direction of the pain in sepia is important in two ways. One is, as I told you, all the pain will be directed towards the back.
Yeah.
And second point is the pain will be more of an ascending nature. So pain
Mm.
from the vagina can be radiating towards the uterus and from the uterus towards the umbilical region. So we see that there is an ascending type of pain, mostly from the vaginal region to the uterus. And then somewhere I think in the pain is radiating from the lower part to the breast region and from ovary to uterus. So, like that, radiation of pain is the. So, this radiation in two ways. One is ascending type from the vagina to the uterus and from uterus to the umbilicus. And then there is a pain which is radiating towards the back. And yeah, there is another pain also in which it is a wedge shaped pain. Isn't it here? It's at this drug. It's a 1 minute because all the drugs have this. Oh, wedge is not there. Shim. Okay. Yeah, I don't know in which drug I saw that wedge complaint. We'll see. So anyway, for now you remember this two pain. Okay.
Okay.
Pain that is coming towards the back and also the ascending type of pain from the vagina to the uterus and to the umbilicus. There can be leukorrhea, yellow greenish leukorrhea, and very offensive with much itching. Because if the uterine complaints are there, associated infection will be very common. And then, because if it is protruded out, bacterial or fungal infection is very common, and that can result in a highly offensive infected. That is why there will be itching also,
Mhm.
yellowish green leukorrhea. Then one of their feature will be tongue will be having a foul smelling, but it becomes clear at each menstrual nisus, and it returns when flow ceases. So there is tongue which is always like a thick fur or a foul smelling or bad smelling. But during the menstrual nisus, that the first day or when it is the menses to appear, at that time the tongue will become very clear. During the whole course of menstruation, the tongue will be very clear, and once the menses finishes, the tongue will go back to its foul nature. Though I say this is a very characteristic feature. Asked as an MCQ also, I have not seen a patient. The medicine Sepia when it was given, I have not seen a patient with such a feature actually.
Okay.
Then there is swelling and cracking of lower lip. Sepia causes engorgement of the uterus or its induration, which means a cancerous condition. And also there can be prolapse or retroversion. Usually it is anti-voted, but there can be retroversion if it is happening. We can think prolapse also. But as I told you, if it is truly surgical, because retroversion sometimes manually has to be done after to that surgically. At that time, will our medicine change? Once it has completely happened, it's very less. In the initial stage only, if it is happening. Anyway, uterine cancer, because the word induration always indicates a cancerous condition, and when there is uterine prolapse or retroversion. The prolapse is a highly common feature of uterus and vagina. It can happen. The pelvic organs in general will be very much relaxed. Although uterus, if you remember uterus anatomy, there are a lot of ligaments connecting the uterus and also the ovary. It's an
Yeah.
important question, yeah. So all these ligaments will be undergoing laxity in case,
Mhm.
and that's how that prolapse is actually being produced. So the pelvic organs will be much relaxed. There will be a bearing down sensation. A bearing down sensation means everything is going out of my vagina. That would be the thought the woman will be having. But that is not just a thought or a sensation, because in homeopathy we say about certain individual sensations, but it is not that sensation. This is a feature. If we go and take our gynec text and see the features of the prolapse, we see that the patient will be having a bearing down sensation. So it's a medical feature itself. It's not a common individualistic, not common, uncommon individualistic sensation that it's a common disease feature actually, that bearing down sensation, because it feels like the uterus which has been kept in position with the help of all these ligaments, it is getting laxed up and it is going down. So the patient will be saying, and I told you this Presidentia case that I have seen. She was very old lady actually. Very old means maybe
Mhm.
60 plus she was. And when we were taking the case, she told that she had this complaint, or she started this complaint after to her third or fourth pregnancy, like around the age of 40. So at that time, and exactly she gave the manner how it develops, as we read in the textbook itself. That initially she used to feel something, that something is coming out, and that is what they say, the bearing down sensation, as if the content from the abdomen or the pelvic area is going to come out from the vagina. So she had that sensation, and then it was protruding a little bit, then going by its own. Then she told exactly the same, the textbook way. Then it came out, and then it was not going easily. So she used to put her finger, with her finger, she used to press it back, and then it was completely coming out. So that's the duration. So in the initial stage, the patient will be having this bearing down sensation, and that the things are coming out of the vulva. And this, because of this, they take different attitudes when they have this prolapse condition. And in case of sepia, it will be the patient is compelled to cross the limbs or press against vulva to prevent the prolapse. So that crossing woman. And now please imagine a model or a film actress who have kept their legs always one over to another, or the crossing legs. So that's how. It doesn't mean they are having that sensation of bearing down. They show it to show their attitude or the body posture, because it makes them more confident. By nowadays explanation of attitude or confidence. But earlier, women were not supposed to cross their limbs like this and sit. It was considered to be totally unmannered or something. But this, because they have that sensation that something is coming out from their vulval region, they sit cross-legged so that nothing comes out of it. The bearing down pains of sepia is of great intensity, and they are felt in abdomen and back. And the pain in sepia from any other part of the body will extend towards the back. And when we learn sabina, we see it is the opposite. In case of sabina, sabina is actually a very good remedy for abortion. Even sepia is good for abortion, but it's more of prolapse and issueless or childless, that is the condition. But in sabina, it is a medicine that is indicated in third month abortion. So, in case of sabina, we see that all the pain from the back is radiating to different parts of the body. And it is the reverse. From different parts of the body, the pain radiates into the back. It is actually sepia. And along with that, this pain extension towards the back, there is a shuddering sensation also. And if it is chilliness, it is pulsatile. Then connected with the uterine symptoms, the patients will be having so many mental symptoms, like she will be hysteric, so opposite or sudden mood swings. Then there can be erythism, some physical symptoms like palpitation, orgasm of blood, or the hypertension, and faintness. So our faintness can be related to this blood vessel affections also. And when we go for erythism, they have some. It can be due to their life change situation. Some behavioral changes are coming up. Otherwise, erythism is a word that was used whenever there was chronic mercurial poisoning. Erythism. So, if you remember learning your FMT, uh, and in that there was something about mercurial poisoning. So, in the acute and chronic poisoning, you would have studied. So, in the chronic poisoning, there was a term that was used, which is erythism, mercurial erythism. So this was an old terminology which indicated the constant contact with mercury The chronic
Yeah.
fasting can result in certain behavioral changes, and that is called as erythemism. So I'm not so sure whether in Sepia, when they use the term erythemism, are they meaning the symptoms of the mercurial erythemism, too much exposure, and then the mercurial erythemism, or are they just connecting it to the behavioral changes that is happening? Um, in case of a mercurial erythemism, they see that in a sepia patient. So even if there is no chronic mercury poisoning, though there are some behavioral changes, whether did they put an erythemism regarding that, I'm not so sure of. However, in erythemism, we see the people with behavioral changes. They will be very irritable, low self-confidence, depression, apathy, shyness, timidity, and in extreme cases, there may be even delirium, personality changes, and memory loss. So, when we read the mind of sepia, it is all these symptoms we can see in them. Then they will be having difficulty with social interaction, and also other than this behavioral changes, difficulty to be in the within the society, they will be
Mm-hmm.
having some physical problems also, which includes a decrease in physical strength, headache, general pain or lassitude all over the body, tremor, as well as an irregular heartbeat. And this irregular heartbeat, we can connect it to the blood vessel or the all that elements, the vasoactive elements, vasoconstriction elements. So many enzymes are the or hormones even which is coming from the brain, which control the BP and all. So alteration in that can change the BP, and that can produce all the physical symptoms.
Okay.
And also, they will be having a goneness, a sensation of goneness or emptiness. And this, I think you have asked in Ignatia, what is this? And I told you, especially when there is a prolapse. Either it can be related to the patient is eating, and due to hyperthyroidism or something, the food being, the metabolic rate will be highly increased in case of hyperthyroidism. The food will be easily
Mm-hmm.
digested, and the person will be feeling hungry again.
Yeah.
The same thing happens in diabetes mellitus. Oh, that can be like that, that empty organ sensation. Or it can be in case of the sepia, like what we say in sepia, the bearing down sensation, and they are feeling as if the content in the strand content. I mean, they can't differentiate whether it is the uterus that is going, but they feel that something is going from their abdomen. Like they may be even saying that my stomach is going down or the intestine is coming down. They may be saying like that, but it may be it's the uterus they are indicating, but they won't understand actually it is the uterus. Initially the thought will be that something is coming going out. That's thought. So that emptiness or organ sensation can be also because of this prolapse or bearing down sensation. So in case of sepia, when they have this, they also have this empty organ sensation, and that is connected to that pelvic bearing down or the prolapse. Then this is also a good remedy for the conditions of pregnant stage, especially morning sickness, the vomiting of food and bile in morning or even milky food. The thought of food sickens her. Even the sight of food, some pregnant women during their morning sickness will be like they don't want even want to see some type of food. Even that can produce a nausea, and some smell. Some
Mm-hmm.
smell can produce nausea in them. They don't want to see even the cooking. And this feature, the even the thought, for them it is not the sight and the smell. Even some food they imagine, they think about, they want to vomit. And this highly sensitive nature towards food we see in sepia. And do you know any other remedies which produces this much sickening?
Wait. Um, no.
Okay. One was asshole, and another, it was there in my mind, it was with C, but suddenly vanished. With C, uh, not cockroach,
Is it
not
like an aversion to food? Would you say?
aversion,
Mm-hmm.
not aversion. It will be like Um, yeah, maybe sometimes you might. There is no necessity. This is a characteristic feature. Of course, we see during morning sickness because morning sickness, women will be having so altered desires and aversions. Aversions in the
Mhm.
sense, I can't say the proper aversion. Uh, this might be a food that they enjoyed when they were not pregnant. But now they don't want it. It is not an aversion. It's a hormonal changes when something happens or they smell. They feel disgust towards that food, and then they want to no, vomit. And once the pregnancy finish, they are going to forget this also. So we can't say it as an aversion like something uh, dislike forever. It is that momentary feeling that she is having. So during
Okay.
even that thought or cooking smell or even sight of certain food, it is going to make her more sick. One medicine is ourself, and the other one it is with alphabet C. It was there in my mind, but it suddenly vanished, and I need some time to think about it.
Okay.
Not not copious carbohydrates, it is some other remedy.
But it's specifically
Mm,
just during
okay, I don't
pregnancy, right?
usually yes.
Okay.
Then there can be abortion also, as I told you. Herring is reported to have said all women prone to abortion should take sepia and zinc. I don't know why he told so, because we have so many other remedies also. Of course, sepia is very good for what is that? Abortion, very good. But we have other remedies, as like I told you, sabina, then helonius, uh, then for abortion, actia resinosa. But when we see zingamet, as such, we don't find abortion in case of zingamet. But in zingamet, we have seen that the vitality is so down. Even the least, what is that, urination and defecation, they need much external pressure. I mean, external training. They need much training to even to do this natural process. Uh, I don't know so why zinc was included by hearing in this statement. Hearing
Mhm.
says then vagina is painful, especially during coition or the condition what we call as dyspareunia. So that is one reason why they don't want to get involved in sexual intercourse because it will be
Okay.
highly painful for them. Then there can be glitch. Glitch will be a yellowish or a greenish discharge that is coming from the vagina, and it is actually a feature of urethritis. So, if the lady had gonorrhea or syphilis, mostly gonorrhea, because it should be this gleat is coming out or a discharge of acute urethritis, and the urethral inflammation usually happens in case of gonorrhea. So they can have, if they are having this gonorrhea, there will be bleach, and that discharge is actually called as bleach. It will be painless, yellowish, staining the linen, which means that even the undergarments will be stained with that. The vaginal meatus, it will be glued together because in the night, overnight, it will be produced, this bleach will be produced in large quantities, and the vaginal meatus that will be sticked or glued together in the night. When we, I mean, because it is produced in the night, overnight, when the patient is waking up in the morning, they see that the meatus will be glued together because of that excessive production of glitch or the acute urethral discharge. So it will be very much obstinate, long-standing, where the sexual organs are weak and exhausted, and this bleed is connected to the condition gonorrhea. I'll just put the word so that you can connect it, and then you will remember the symptoms. It is the gonorrhea, the acute urethritis, which produces the bleed, and it will be produced in excessive quantity overnight. So when the patient wakes up in the morning, they see or the meatus, the vaginal meatus, the two separate uh, feather or wings, I don't know how to say, the muscular portion of the vaginal region that will be glued together. because of this excessive meatus production. Sorry,
Okay.
excessive gleek production. So it can be given as summarized in the above. I told you every condition of irregular menses: early, late, scanty, profuse, amenorrhea, menorrhagia, etc. But we should have the above symptoms: the indifference that we discussed, the low vitality, the languid, the very much prostrated condition, all the pain radiating towards the back region, the washerwoman. So all these symptoms when come together, we can give for any menses complaints, but usually the menses of Sepia will be uh, delayed and it will be late and scanty. Okay, so you
Okay.
see, when they say it is early, they also have the option of late. When they say about scanty, there is profuse. When they say about amenorrhea, there is menorrhagia also. So anything is possible, but all the other symptoms what we discussed should be there. But generally, the feature, the menses of sepia is actually very late and scanty. And why I'm repeating is it is very important when we go for its comparison with the murex. So regarding other symptoms, one of the characteristic feature, one we saw that they are having empty gone sensation, yeah, but they also have another sensation now, hysteria. Because they have the hysteria, they have a ball-like sensation in the inner parts of this body. The hysteria producing a ball-like sensation, we in the throat region, we saw that in case of ignatia. And
Mm-hmm.
over there, we use the term globus hystericus.
Yeah.
I told you that it comes from the abdomen for them, and they feel like something stuck over there. And when they're swallowing something, it goes down, and then again coming up. It was nothing organic pathology. It was just their sensation. Even the same thing that hysteria is there in sepia also. So they have the ball sensation, but now just in the throat region, they will be having anywhere in the internal organs. So sometimes, in case of head, they will be having something is rolling around in the head, and there is vertigo also. And we already saw that the patient will be having sinking faintness or easy vertigo. So along with the vertigo, they feel like that something is falling in their head region. And then this ball sensation we can see in the rectum also. Something is there in the rectal region. And usually that rectal ball thing is what they mean is rectal prolapse has happened mostly, a ball-like sensation, and it is not relieved by stool, or there will be constipation. So they feel like there is a ball outside to the rectum, which means or the anal region, which means the rectum has protruded out. But and that if it is something that is blocking the anal orifice region, then of course the stool passage won't be easier. There will be constipation, and the severe patient actually do have constipation. So even if the stool passes, it doesn't really. It doesn't really means it has gone to the completely last stage, the procedential stage, the complete prolapse. Even when you pass the stool or do anything, it is not going to go back. It has completely came out. So the bone sensation is highly characteristic. So they have that empty or gone sensation in sepia, which we can connect because of their prolapse nature. And then they have this ball sensation also, which is seen in different parts of the body. Then they have the portal stasis. I told you the portal affections are there. So there is fullness, soreness, or a stitching pain in the liver region. And not only just in the liver region, we can see that a stitching pain in the left hypochondria. So the condition in which there is hepatomegaly and splenomegaly, you can think about sepia. It is indicated in enuresis or bed wetting, especially in the first stage. The bed is wet almost as soon as the child goes to sleep. And this is a feature that is during the first sleep we see in sepia and also creosote. Creosote is another remedy in which there is enuresis in the first sleep. I mean, the child just goes to sleep and then itself it starts bed wetting.
Okay.
And in case of urine, the sepia urine is highly, very, very offensive. If we are made to stand it for some time, you can see a reddish clay colored sediment, and that adheres to the vessel as if it has been burnt on. And when we say this reddish colored sediment, it is not some, I mean, even in lycopodium also we have seen that. In sarsaparilla, we have seen, and I told in sarsaparilla, most probably it will be whitish sediment. And this
Okay.
reddish sediment and whitish sediment is nothing like some sediments of brick color is coming. If it is reddish, it is actually the disintegrated RBCs. And if it is the white sediment, it is actually the disintegrated pus cells. So if it is the red cells that is going, more the condition is the glomerulonephritis. And if it is the white cells, it is the pyelonephritis. So anyway, indicating pathology. So though this is the medical language, the prover's language, so they say in the colloquial way of saying, but everything we make can connect it to the current diseases. So the red color sediment means they have some complaint of urinary. The hematuria is the something related to glomerulonephritis or any other condition which there can be hematuria. Even a single kidney stone or nephrolithiasis, which can produce hematuria. That can be the. So when the urine is allowed to stand for a while, we see this reddish sediment, which is actually the disintegrated RBC, and it adheres to the vessel as if it has been burnt out, like the urine has been present in the vessel and then it burnt, and then that's how it became red. We feel like that. It's so fetid, so offensive, it should be removed from the room immediately. And in the skin, we already saw that telltale phase when there is a excessive deposition or that yellow saddle phase. But even otherwise, there is skin pigmentation, which is chloasma. Generally, it happens, and if it is happening during pregnancy, we call it as melasma. Then there can be herpetic eruptions on lips and mouth. Ringworm. Ringworm is an important feature of case of sepia and herpes cercinatus. So the condition chiasma or melasma, pregnant women during their last trimester, in some of them, especially if they're very frail, you can see they're getting very dark. But after the pregnancy, I mean after delivery, they will regain their original color. It is very less that they remain in that pigmented stage. They will regain their original color, the complexion. Um, and it is more obvious in very fair women, not medium complexion. Not so we have this hepatic eruptions, the ringworm of the face, etc. Then there can be nettle rash also, a kind of allergic reaction, and that usually happens when the patient is going into open air. It is applicated in a warm room because the patient is extremely chilly. So that makes also a next point. It's a chilly remedy from lack of vitality if she chills so easily, and it is especially in case of chronic disease. Regarding the modality aggravation, there is forenoon aggravation, evening aggravation, the anxiety, especially during the anxious thought, it aggravates in the evening. Washing, dampness, left side, also important. Before thunderstorm, that's another important thing. Then amelioration, see the amelioration exercise. It's
Okay.
feature I will say you in respiratory. Okay, what I told you when the least exertion is going to bring about fainting in
Nice.
them, and then I told,
Oh no, no, I see. No, I answered painting.
so fainting will be bringing about by the least exertion. So then we expect the person to rest, and yeah, we see that resting also, but then we see amelioration by exercise. And why this exercise comes, I have put all that in actually when the respiratory complaint, when that is being compared, I put the symptom over there. So I'll say you the, but see this thing. They have amelioration by exercise, warmth,
Mm-hmm.
hot application, drawing limbs up, cold bathing after sleep. Doesn't matter this much. You can just remember exercise because it's so different, and warmth of that because it's chilly patient. Generally, warmth will be amelioration. That will do. So we go into comparisons. The female reproductive system will be the most important to compare, and here we have the remedy Sepia, uh, Iodum, and also Murex. It is mostly Sepia and Murex because Sepia and Murex, we told that Sepia is having prolapse, even Murex. Murex is also having prolapse. But there are two differences between the prolapse of Sepia and the prolapse of Murex. So that 2 points make this question very important. the female reproductive system of Sepia and Murex. And another one which is having important female reproductive symptom is Iodum, because when we go to Iodum, we don't see any prolapse over there, but Iodum generally it has got action on glands. So that means over the uterus also, and they can produce indurations, means cancerous conditions. So that's why iodine female reproductive system gets important. This iodine is having symptoms in the female reproductive system because they can produce cancer, but they are not producing any prolapse. This feature of prolapse of uterus that is seen in case of sepia and murex only, and they differs in 2 points. So sepia female reproductive system I'm not explaining again because we already have dealt about in detail. So just
Yeah.
put that. And in females, in case of murex, we see that murex is especially adapted to nervous, lively, affectionate women, patient with great sadness, anxiety, and dreadfulness. So some were almost similar to sepia. Constitution also. There is sadness, there is anxiety, there is dreadful thoughts, nervous people, affectionate people. Even sepia, we have seen that they are mild, gentle in disposition, though they are anxious, very sad, and all. There is a sinking organ sensation in stomach that is seen in sepia also. But okay, this is the symptom in. There is a difference over here also, but this symptom is usually in GIT, not the female reproductive system per se. But this, because the organ sensation I told you can be connected to the prolapse, I just put it over there. So this organ sensation in the stomach, both the drugs will feel sepia and murex. And sepia, both the drugs, when they have this organ sensation, they want to eat food to make it full. But
Mhm.
Sepia won't have any amelioration. Even if she eats, she doesn't have any amelioration. However, Murex, when she eats, that will be ameliorating this organ sensation. Then we go towards the womb region, womb of uterus. In case of murex, they have a very conscious sensation. Means there is some pathology in the uterine region. They have a maybe sudden pain or something when they move here, something because the pathology is so severe. They have a conscious sensation. Otherwise, if someone asks, I mean, to medical students, they ask what is the position of the uterus. We will keep our hands the supposed area of uterus. But a general woman is asked where is the uterus. She can't position it. She may be keeping somewhere in the abdominal region. She can't exactly
Mhm.
point out. And even for ultrasonography, until because it is a pelvic organ, this one, uterus is, uh, unless a woman is completely like in the uterus has come out from the pelvic area, it can't be even viewed under ultrasound scan. We actually, if we are going in a very young age to do an ultrasound scan, we have to drink water, inflate the bladder, and because it is seen behind to the bladder behind or about to the bladder, the cervix comes over to the bladder, I think. So when the bladder is expanding, the uterus also expand, not expands, it will be pushing uterus from that this area, the pelvic area, towards the visibility area. So some anatomical connection is there. So otherwise, no woman will be able to exactly locate the position of uterus. But in this, because they have some pathology, they have a conscious sensation. Like they know where is they can point out where is the uterus. So because they have some symptoms over there, feeling as if something was pressing on a sore spot in the pelvis, and it is aggravated from sitting. Even if you can't remember this sentence exactly, you can
Mhm.
just try. There is a conscious sensation in the womb. A sore spot can be located, or something like that. A sore spot, like something pain or something is the sore sensation is there that she can say where is the or locate the position of the uterus. Which in simple words means there is some pathology in the uterus. Otherwise, she wouldn't have been able to do. Now, and though we say this is in Murex, this conscious sensation and the soreness or the sore spot felt in the uterine region, this is more so important in the drug Helonius. When you learn Helonius, you will see that the sore spot, the sore sensation, it is highly characteristic in case of Helonius. But
Okay.
even if in case of Murex you forget this symptom, doesn't matter. That's what I didn't put any color also over there. It doesn't matter even if you forget it. So they have also prolapse and there will be tenesmus. Means they're trying to they will be like pushing it. Pushing it in the sense that let it go, but there will be a gripping pain, that is the tenesmus actually, and there will be a sharp pain which is extending towards breast. So this pain nature radiation also we saw in sepia. Sepia also we saw that the pain is coming from the vagina to the uterus, from the uterus to the umbilical region, and even it can go about towards the breast region. So the ascending pain is also similar. So we see that some symptoms like the constitution is almost similar. There is prolapse also. There is an empty organ sensation. There is some difference with the modality in the empty organ sensation of sepia and murex. In murex, it is ameliorating if the person is going to eat, and sepia, it is not ameliorating. And in this prolapse, we see the murex also wants to keep the legs tightly closed. So both are having the same attitude. Oh, they want to prevent in the same manner. Both keep their legs closed. Then what is the difference? The first difference comes over here, which is the I told you the two important female reproductive system symptoms itself. All the prolapse features, pain, radiation, sensations, everything is same. The difference comes one in their sexual desire. So in Sepia, I told you they are not at all interested in sexual intercourse. The vagina is very sensitive, coition is very painful, and also mentally. Mentally also they wouldn't be interested in having sexual intercourse. They have complete disinterest. But in case of murex, the sexual desire is highly exaggerated. They are easily excited. The least contact, like in lacanine, the least contact can bring about violent sexual excitement. And in female, there may be even nymphomania. So that is one difference. And the second difference is in case of murex, the menses will be irregular but profuse. And in sepia, we told that anything is possible, menorrhagia, or even late, early, scandy, profuse. But then I told you, but mostly the commonly seen feature of sepia will be scandy menses. But in case of murex, it will be profuse menses. So the symptoms of prolapse, when it is compare and contrast the female reproductive system of sepia and murex, you see almost same feature except two. One is in their sexual desire and another is in the quantity of the menses or the menstrual blood. Okay.
Okay.
Then in case of leucorrhea, there is leucorrhea in case of sepia. And how was the leucorrhea in sepia? Do you remember?
Um,
I connected it to the yellowish green nature because of the prolapse, the sudden infection, and the
the
gambit,
me
the yeah, the
was it?
yellowish green, the fungal thing, etc. But it is not that leucorrhea caused them any trouble or not. It is like some infection and then related. But in leucorrhea, though this is not a difference per se, but this is a characteristic feature of murex actually. Leucorrhea aggravates mental depression.
Okay.
Happier when leucorrhea is worse.
Oh,
Wait, there is some accusation. Did I make a mistake with the sign? Leucorrhea, it should be ameliorating. So leukorrhea is aggravated during mental depression. That should be the meaning. And the person will feel happy when the leukorrhea is worse. So when leukorrhea is going, she is very, very, very happy. So that's a rare
oh,
feature. Woman will be happy when leukorrhea is going. That is
okay.
women. So murex. She will be very happy when the chorea is worse. Then it can be also given for benign tumors in breast, like the adenomyosis. Then what is the mouse adenomyosis, and some other condition is also the running mouth something. I forgot. So those benign tumors in breast, we can think about Murex. So the characteristic feature in Murex that you have to remember is they have that increased sexual desire, nymphomania, and menses being very little. I mean, sorry, menses being very profuse in nature. And lastly, leukorrhea will make her happy. When the leukorrhea is worse, she is mentally very happy. So that is the female reproductive system, the two symptoms you have to remember. And in third one, that is iodum.
Mm-hmm.
I told you the female reproductive system, there is no prolapse, but it is because they are having a cancerous condition. So the constitution of iodum. And in case of iodum, now you can imagine, we already told that iodum will be somehow related to the thyroid complaint. So mostly iodum patients are very much um, thin in nature. So hyperthyroid patient, hyperthyroid constitution, what we say that is what actually iodum is. So iodum is indicated in scrofulous diaphysis, means when the glands in the neck region is affected, and of course thyroid gland is affected. So scrofulous diaphysis with the dark constitution. The person will be looking very dark, black hair, black eyes, a low cachectic condition or the cancerous diaphysis, the profound debility and great emaciation. So the hyperthyroid patient. And if this thyroid complaint is seen in a person who is having a fair complexion, the medicine would be bromine or bromium. Have you learned bromium?
Oh no.
So this is usually a one-word MCQ that is asked. So thyroid complaint in a
Uh-huh.
dark person, that will be iodine. The thyroid complaint in a light complexion person, it will be bromium. And both iodine and bromium belong to the halogen group.
Okay.
Now, uh, okay, and then they also have liporia, iodine, which is acrid, corrosive, staining, and corroding the linen. I hope you understand all these terms.
Mhm. Yeah.
Yeah. And this leukorrhea is most abundant at time of menses. Just imagine. I can't imagine which will be more. How the lady will discern it, which is menses, which is leukorrhea. I don't know how she will discern it. But anyway, the leukorrhea is most abundant at time of menses. But I don't know. Even if, though I put it in that, even if you forget, I don't think it is more important because how to differentiate. But this speaks.
Goodness. Wait, I have a question.
Hmm.
How, how do you differentiate between acrid and corrosive and burning?
Both are same. I mean, three are same. All the three are same.
Uh-huh.
Because if we are saying in Materia Medica, we can you can see the similar pronouns being repeated.
Uh-huh.
They will say thin, lean constitution. Thin is same as lean. So
Oh.
then there will be like uh, lethargic, leukophlegmatic. Both are same. Lethargic. They don't want to move about. Leukophlegmatic, same. Tiredness. And this is almost similar when we say in medical condition, some fever, and when we say prodromal symptoms, some
Okay.
of the fever, like a typhoid or something, in prodromal symptoms, we say, uh, no, wait 1 second, there is a rhythmic way of saying that. Uh, Fever, body pain, body ache, malaise, all are
It's
same.
not the same. Yeah.
Mhm. So I don't know why they make it so. Maybe to keep it as a rhythmic. So because we had to memorize a lot of symptoms, so it is just one symptom. Maybe the stalwarts or whomever people. Because this was a question I used to ask myself. If the words
Uh-huh.
are same, why they are repeating it? Why they,
Yeah.
and then the only answer I got is maybe to make us remember when we if otherwise one word we forget, but then we remember it in a sequence, and then we never forget that. So that should be, otherwise acrid is like acid itself going to burn. Corrosive is same thing. Whenever wherever it is passing through, it is going to corrode that area like acid or a strong alkali like.
Mhm.
And burning also, when it is gumming, producing that redishness and the burning pain. So ultimately, everything is safe. It is going to affect the skin and the mucous membrane, going to burn the area along the course how it flows. So there's no difference. It's just out of practice. It's a medical language uh,
Okay.
that they put it like that. Otherwise, no difference.
All right. Understood.
Okay, so in case of Leucorrhea, this one I don't know how can we differentiate. Uh, so I don't care about personally. Anyway, because this is having a cancerous condition, we see the cancerous degeneration of the cervix. So the female reproductive complaint of Iodum is more important because of its cancerous nature, its destruction. So the hemorrhage related, the leukorrhea related. Otherwise, prolapse is not a feature. Then another important female reproductive system symptom that will be more with the breast in case of iodine. So in iodine, most of the glandular tissues are having hypertrophy or induration. So these glands can be thyroid gland, mammary, ovaries, testes, uterus, prostate, or anything. And because we are mentioning about the female reproductive system, we already told about the cancerous condition of cervix. We connected it to this leukorrhea, and now we come towards the mammary condition. So all the things what we mentioned over here, the thyroid, testis, uterus, everything, there is a cancerous condition, and it is actually becoming, uh, um, what is that, atrophied, atrophied, all this structure when the cancer is coming, or cancer is there. But breast is the single organ or the single structure in Adam which is actually getting hypertrophied. The cancerous condition, it becomes dwindle and become flab. It is not getting atrophied, but it is becoming hypertrophied. So that is the importance of item. All the structures that we mentioned in this thing, the glandular tissues, in which there is induration or there is hypertrophy. Hypertrophy, yeah, but it is mostly atrophy. But breast is a structure that will be dwindling and becoming flabby in nature. And there will be also nodosities in skin of the man. So this thing, all the other structure being atrophied, but uh, the breast dwindling is seen in case of item. Then in the female complaints, they also have great weakness during menses. Menses is irregular. There will be uterine hemorrhage, which can be connected even to the cancerous condition. And there is ovaritis, and here is the pain. I was thinking, where did I see this wedge-like pain? There is
Mhm.
so it is in either a wedge-like pain in the right ovarian region or from ovary to uterus. So now you imagine the anatomical position of the uterus and then the ovary. So either in the ovarian region they have the pain, or from ovary to uterus. So if we are going to draw, it will be like a triangular or a wedge shape, so like a cutting of a cake. That wedge shape will be that pain. So that wedge-like pain is a characteristic feature from
Okay.
ovary to uterus, and that's a feature of iodine. So that's the female reproductive system. Um, so remember the sepia and
Mhm.
murex prolapse. Almost all the symptoms same. The difference will be into the sexual character. One is nymphomaniac and another the menses being very profuse in murex. And other two differences will be the empty organ sensation, which is not ameliorated by eating in sepia but ameliorated by eating in murex. And in leukorrhea, it doesn't affect. I mean, there is leukorrhea in sepia, but it's not generally affecting mental symptoms. But in case of murex, the more the leukorrhea, the more the happy the lady is. And then item, it won't be comparing. It won't be asking you to compare the female reproductive system of Sepia, Murex, and item. Never. Because it's the Sepia, Murex, the prolapse thing which comes together and the differences, commonalities which will be asked. Iodum, if asked, it will be asked separately. Mention the female reproductive system of item. And that is related to the cancerous condition. Remember the atrophy that is happening in all the glandular structures, but in case of breast alone, it will be dwindling or it will be becoming very flabby in nature. And that great weakness, which like pain. When did we start? 9:35.
9:40.
Okay, we'll stop over here. Now there is GIT, respiratory, then heart complaints. Also,
Oh,
so, yeah, heart is the not for Sepia, but for Spongia and iodine.
okay.
So we'll do the rest tomorrow, not tomorrow, the next class.
Okay.
Next class also Wednesday. I told you I won't be there. We'll do it on Friday.
All right.
Okay, so did you take a picture?
Screenshot?
Not,
Yeah.
not over here. Because that portion we didn't take. Some heading was better. Yeah, over here.
Oh, you want me to screenshot here?
Yeah.
Okay. Mm, okay then.
Okay.
All right. Thank you, Miss. I'll send you right now.
Okay. Thank you.
All right. Thank you. Have a great weekend. Bye bye.
You too. Bye bye.